question that is commonly asked is, can I help with a bulging disc? And the answer is absolutely, I can help with that bulging disc. The thing to understand is a bulging disc had to occur from something being off balance. And that can be an injury. For example, someone was golfing and turned the wrong way, or lift and twisted, or was shoveling, or putting something in their trunk, or pulling and twisting at the same time, causing a twisting motion in the spine and cause those annular fibers in the disc to become weakened and cause it to bulge. A bulging disc can happen over time gradually as well through chronic misalignment of the spine. An analogy that I like to use is the alignment of the tires on your car. When the alignment of the tires are such that the tires, when you turn to one side and come back to center and turn to the other side and come back to center, when they're lined up and they're straight, then there's not going to be an unequal wearing of those tires. When someone ignores the alignment of their car tires, say the front tires, and it's off alignment for whatever reason, then that constant wear and tear is going to weaken the side of the tire, and then when you randomly hit a light bump in the road or a pothole, it can cause that tire to bulge. And what you can do with that tire is you can go get a brand new tire, but what do they do when you go get a brand new tire? They realign the axle. And that's really important to understand when you have a bulging disc in your back, that alignment is the absolute most important key to allow that disc to heal appropriately. So with a car, you take off the tire and you put a new tire on and you realign it. With a bulging disc, they can heal, but it takes time. And so what you want to do is you want to realign the spine, set it up so it's balanced so that bulging disc can heal on appropriately and not have an unusual traction on it, like an uneven pelvis if one leg is shorter than the other, or one hip is twisted more than the other, or there's imbalance in the low back. So what I do is I take an assessment of you, and one of the good things about what I do is I use the activator, and I've talked about this, and you can go to my activator video. Very, very important, because when you have a disc in your low back generally, or in your neck, the worst thing that you would want done to it is for it to be twisted. And because I use activator, you can see my video on the activator technique, there is no twisting whatsoever. There is just a gradual balancing and resetting of joints that are off balance, using a gentle technique to realign very gently the body so that disc can heal appropriately. And it does take a long time in a healthy person. It can take 16 weeks for a disc to start healing once the spine is balanced. So can what I do help with a bulging disc? Absolutely. I have had a lot of patients that have come to me with disc pain, and if you've ever had disc pain, it is excruciating. It is nerve pain, and it's one of the most worst pains that anybody can go through. And I feel sorry for when these people come in, but I work with them until we can get them stabilized. And even if they decide to go for a surgery, which is a good solution for this type of issue when it's, for example, a sequestered disc or one of the higher graded disc bulges. But when people come to me, we work with them, maybe get 4 or 5 treatments in, and if they do decide to go for surgery, they're going for surgery with a much better balanced body. So when that doctor goes in and does a surgery, it's much better. But a lot of people that do have a bulging disc, a minor bulging disc, or a very minor effect pressing on a nerve, can chiropractic help? Yes, absolutely. It just sets it up so it can heal properly. It opens up the channels. It opens up the blood vessels. It opens up the flow in that joint so it can receive the nutrients so it can heal.